from the I'm from the CPT class.
Who's that?
Mary.
Uh-huh. Yeah, yeah, stick around. You
Yeah,
don't have
that's why
to.
I joined you. I was like, oh, I'll just join in and listen.
Yeah, just stay. You can stay. I mean, I'll just explain it to the others when they join. If they join, I'm gonna type a message in here.
I have a huge question,
Yeah,
and I'm
sure.
so confused. Okay, so I'm working at a
Mm-hmm.
hospital outpatient clinic.
Mm-hmm.
Okay, so they have adults, OBGYN, and pediatrics.
Mm-hmm.
And when we check in the patients, I have to put a visit code, an E&M code, which they want us to put 99211.
Mm-hmm.
But then if it's then the physician also puts in their E&M code.
Mm-hmm.
So like my E&M code goes under like facility, established, new, whatever.
Mm-hmm.
And theirs I think probably goes under patient. Is that correct that you would build two E&M codes?
I've seen it done. Yes. Yeah. I mean, so they want one for the facility and one for what?
And then one for the procedure?
Yeah. So it is possible that that can happen. I mean, every setup is different. Where you work at a teaching hospital or something?
Um, it's the Catholic Health in Buffalo.
Okay. All right.
So, yeah, so they do two E&M, and I was like, I'm very confused. I thought you can only do one E&M code,
Okay.
but you can have two, one for facility and then one for procedure.
It's not one. It's an E&M and then a procedure. But procedure codes are different. Procedure codes are these kind of codes, right?
Yeah, but they're using like for well child.
Uh-huh.
Okay,
What's the code they're using?
what's that?
What's the code they're using for that?
Well, they were using the wrong codes until I spoke up.
Good on you.
Uh-huh.
Good on
Yeah,
you.
the preventative. They're they're doing the preventative E&M codes for like their well visits.
Mm-hmm.
So they're doing like 99 say 32 or 99382.
Okay.
So they put in that procedure code 99382,
Mm-hmm.
and then we have to put in a facility code of 99211, or if they're getting immunizations with a modifier 25.
99382. Hold on.
99382.
Hold on. Let me see
It's
what
on
I.
like in the E&M, like on page 37 in the 2020, probably 36 in the 2019.
99382. That's saying an invalid code there. Hold on.
99382. It's
Yeah.
new. Oh, that's a new preventative.
99382. It keeps coming up invalid. It says
Try 99392. This is CPT, right? Yeah. In
yeah,
my CPT book.
99392.
Yeah.
That's it. Okay, hold on a second. I'm missing something here because it's not coming up. Let me go to the book, actual book, to see exactly how the code is set up.
Yeah, it's an E&M. Try page like 36, 37, 38.
Yeah, I see. I see what you're talking about. Early childhood. Yeah. Um, I'm not sure why I'm not sure why the encoder won't take it. Let me see something. Let me try it again. It could be that some. Okay. Here's another thing. Um, it is possible this encoder is probably reading it like because a different way because majority of the time you don't code E&M in the facility side, right? Some I mean, it's rare. There is times when you have to, like in your case, and there's times when you end up having to code for the facility E&M code, and you end up also having to code for the what do you call it?
The
The
procedure.
the professional E&M code. I think that's what you're referring to. Not the procedure. I think you're referring to the professional. You have a professional code and you have a facility code. Um, Let me explain that. So everybody knows. And Mary, how long you been doing this?
I've been there since March.
Okay. All right. So let me explain how this works.
But this is the first, like, I mean, I've been learning coding for like the last couple of years, but I've never heard of this before. So I was like, why are you guys doing two E&M codes? I'm so confused.
Right. And I think I know exactly where this is going. Let me explain it to you. So, um, what happens is that when you are looking at from this point of view, this is what you want to look at. When you go to a hospital, you're going to incur multiple bills, right?
Mm-hmm.
You'll incur physician bills, whether it be from the pathologists, the consultants, the whoever. You're going to incur multiple bills.
Right.
So the point of view that you want to look at it is like this: the hospital, in this case, the entity that you're working for, decided to take over. They have the physicians in there. They were actually working directly for the hospital, as
Uh-huh.
opposed to it being outsourced. There are companies out there that pretty much will staff the hospital from an internist point of view. They may staff them from a the emergency room point of view. They may staff them. Um, the consultants now we may come in from their own doctor's offices, and they come in, so they call in from their doctor's office to come consult. So they're going to bill too as well if they come in and see you, if they're called in on that case. So but in your case, what I think is happening is that you have the facility component, and you have to capture that with an E&M code, and
Mm-hmm.
then you're going to capture the professional component, the facility, the professional component. It's going to be two separate bills. So that's why I think you end up billing two separate E&Ms. I think that's what's going on, and I think somebody didn't properly explain that to you. So the doctor's charges is going to be separate from the facility bill. This is why when you go to the hospital, you come away with different bills and all kind of bills when you're trying to make sense of it, because everybody's going to bill you. Everybody that touch you, the facility, they're looking at it from this point of view. You're lying in my bed, you're eating up my resources, so I'm going to bill. The doctor that touches you and actually examines you, they're looking at it from this point of view. You are, you're being seen. I'm actually examining you. So for that labor, I need to get my charges captured, and that's what they're gonna look at. If anybody from the CPT class is currently watching, you need to type in the chat area so I know that you're here, so I can get started on that portion. Um, and yeah, but I don't know how many people see this. This is so awkward for me to be doing it like this, and I apologize, guys. But the WebEx account just um, I don't know what happened. But CPT class, just type something in the chat and I will see it, and I will know that you're right if you're here. Okay. Um, so that's what's going on. Any other questions? Did you get it, Mary?
I get it now. Yeah.
Okay. I see two people watching. I don't know if they're from the CPT class or not. I know I have 137 people on my YouTube channel. I rarely use this, but it's just my go-to for today. I needed to have you guys on because I couldn't go a second night or third night without talking to you guys. I miss you guys.
I
So
know I was off. I was all set for yesterday.
yeah, I know. And then my wife had me doing a ton of things. Uh, you know how you ladies do it, ton of things. And so
I don't know. Do we
I
know what he's talking about, girls?
I have no idea.
Jesus Lord. She's like, well, they can wait. This is important. I'm like, okay, babe. Okay, babe. Don't want to be sleeping on the couch. um, but then then this happens. I'm so mad with WebEx right now. And then because of COVID-19, their offices are not staffed, so you have nobody to talk to. You're on hold for like an hour, 2 hours. I was literally on hold for an hour before when Angie and Lajaya joined me. Um, but it is what it is. One person is watching. I don't know who it is, but hello to you too. Can you comment so I know who you are?
I think Terry was going to come on tonight.
Yeah, I know Terry was. I know Terry probably upset right now because of the missing time. If anybody from the class is here, please join in.
Hey, Bill. I think that'll be enough, lady. Oh yeah, that should be more than enough. I'm gonna. They called me. Have to go back to work tomorrow. Do you? So I'm gonna go when I get out of work. Well, if you don't need to go. I can go tomorrow. It's not a big deal. Okay. So you get to go to work tomorrow. Yay. We'll see you tomorrow, Bill.
Yeah. So let's see. Oh, Delona is here. Okay, I was looking at the wrong thread. Okay, I was looking at the private chat as opposed to the comments chat. Hi, Delona, and I see everybody else is coming in. The numbers are growing, so that's good. Hey guys, I'm sorry, we're doing it a different way today. WebEx is giving me issues, so once you come in, just go ahead and type you're here so I can see who is joining. Okay. So we're gonna do this tonight. We're gonna do this tomorrow night. I don't know if by tomorrow if I can get this resolved or not, but we're gonna do this tonight. We're gonna do it tomorrow night. If anything, we're gonna meet right here tomorrow night. I have a feeling I'm not gonna get this resolved by tomorrow night. But so we're gonna meet right here. We're gonna make the best of it. But I can't afford to have you guys wait for me for next week again. That will be not cool. So I just want to get this thing going because I had my wife kept me occupied yesterday and she got me occupied last week and I'm gonna go. I know you guys are probably mad with me, but hold on one second. How do I log it into this APC thing again? I just totally forgot now. There it is. All right. And you jumped off.
Select the area of the course you wish to view.
Okay, we did all of that before, didn't we? I think we did. I didn't forget where we left off. I think these chapters are kind of messed up. That's chapter 12. 9. 6. Okay. All right. I think we left off at twin tags and shaving the last time. So let's go to destruction.
This module focuses on the procedural coding for integumentary system for destruction, with CPT codes ranging from 17000 to 17286. Select the area of the course you wish to view.
While the skin is the largest organ system in the body, the skin, along with the hair and nails, comprises the integumentary system. The skin performs functions such as protection from injury, fluid loss, and microorganisms, temperature regulation, fluid balance, and sensation. The layers of the skin can be broadly classified into the epidermis and the dermis.
Click on the buttons to learn more.
Epidermis is the outer layer of cells covering the body and is composed of stratified squamous epithelium. The epidermis acts as a major barrier against infection and regulates the amount of water released from the skin. While the epidermis is thinner on the eyelids, it has a thicker composition in the palms and soles. Dermis is the lower layer of the two layers of the skin. The dermis layer is composed of the blood vessels, lymph vessels, hair follicles, sweat glands, and sebum.
Okay, the numbers are increasing, so folks are joining. Once you arrive, class, let me know that you're here so I know who's joining us tonight. I know Delona is here, Angie is here. Just type a message in the chat area so I know who is here watching.
The epidermis is further classified into 4 or 5 layers, which includes the stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, stratum basale, or germinativum.
Click on the buttons to learn more.
Okay, you guys are aware of these terminology words, or do I need to go over them?
I know 'em.
It's fine.
But isn't that like a question that they would ask on the CPC exam?
Yeah, more than likely in the terminology section. So this is probably going to come up in the terminology section of the test.
So this would be something good to write in our books.
Yes, ma'am. So these words right here. So write them down somewhere. Okay, Delona says she knows them, which is good. Hi, Sandria. Hi, Betty. Welcome. This is unusual how we're doing it tonight, but I'm having issues with WebEx, and I can't log into my account. And I should have smelled that something was wrong, because I did see some folks post some messages last night that they couldn't log in, but I didn't follow up because I was so busy helping my wife doing some stuff around the house. And yeah, so I've been sitting on the phone all day trying to talk to somebody. Because of COVID-19, your office is not staffed, so I have to rely on waiting, hoping I can talk to somebody. Anyways, call you guys up. But if you guys want to talk one-on-one, send me a message, a PM about anything. This is also known as the finest layer, produces lamellary bodies enriched with polar lipids and so forth. That's the stratum. You guys have that written down? Tell me when you're ready for me to keep going. For those who are writing. Mary, are you writing?
Oh no, I just take pictures. I
Oh, you're
don't
taking
write
pictures. Okay. Yeah, okay, yeah, that's even better. Take pictures.
Faster. I'm faster.
Yeah, that's bad. Yeah. This is the outermost layer of the dermis, which is also known as the horny layer. It is composed of 10 to 30 layers, the thickest layer being in the palms and the soles. And then this is a peritium, the characterized in the layered loose layer nuclei and cytoplasm and appear less granular. It's also known as the germophilia, and it is attached to the basement brain and so forth. Okay. Any questions? As you get in here, go ahead and type that you're here so I know who is here. I think more people has joined since I've been talking. We're gonna meet again tomorrow night as well. Okay. Tomorrow night is gonna be 1 hour, 7 o'clock, and finishes. I'm gonna be done by probably 7:50. Okay. Hi Kevin, I am not to work this. I'm not sure what you're saying, Jennifer. How to work this? Oh, well, you just need to watch. You're not going to be able to talk to me tonight and talk back to me tonight, unfortunately. And so therefore, you're just going to need to watch and communicate with me via the talk, the just how you're doing right now. Okay. And more than likely, it's going to be the same thing tomorrow night. I'm praying to God, I'm gonna work this like a hawk to try to get somebody to help fix my account between now and Thursday. So Monday when we meet, this is not going on. And Monday we will be meeting. I'm already make sure that I told my wife, I said, I can't keep doing this because these ladies are waiting for me to do these classes, and she keeps using me up. So definitely Monday night. We're definitely meeting, and it's definitely going to be by WebEx. So don't worry about that. Okay. And if I'm available Saturday, I may put something out there. I know, well, I haven't seen anybody signed up for the 3M class for Saturday yet, but I'm opening it up for anybody that wants to join me on Saturday. I will drop something in the group, and then you guys just follow the link, whatever link I give you, and just join me. Okay. So that's for Saturday. But again, I haven't seen anybody sign up for the Saturday's class. Mary and Ligia, are you guys going to join me for Saturday's class?
CPT?
For 3M?
Probably not.
Yes, probably not. I don't know. I'm not sure. So.
All right. Once you make up your mind, send me a note by Friday, because right now, as of today, nobody has registered for the Saturday's class that I know of. I have to go back and check my emails, but I have not seen that. So if that's the case, then I guess we will just focus on CPT for whoever wants to come in and hang around with me for a couple of hours, because we really need to catch up on this stuff. But whoever, you guys are grounded. You guys not going anywhere, right? You're like me. I've been sitting on my can sit on my house in February. And I can hear the folks on YouTube laughing right now, although I can't really hear them. But you can put LOL
Some
in
of
the
the
chat.
terminologies for diagnosis and procedures of the skin include the following.
Click on the buttons to learn more.
All right. You guys should know these terminology words or have an idea what they stand for. I'm just going to quickly click on them, and then you can take pictures if you want to. Okay. This one is basal cell carcinoma. Does anybody know how many questions on a COC? How many questions is on the actual exam for terminology? Does anybody know? Is it 10 like the CPC? I'm not sure. That's something I have to look into. Is there a tape delay? Because I've just seen Delona's LOL. Benign fibrous tumor. Ablation. Skin infection. Yeah, it looks like there's a tape delay for some reason. Are you guys taking pictures of these, or should I stop?
No, yeah, go ahead.
Okay. All right, let's move it on to the next screen. Let's just click on, oh, we didn't do the wards, sorry. All right, did we do all of them now? I think we did.
Lesions is a common diagnostic condition of the integumentary system and includes categories such as benign, pre-malignant, and malignant.
Click on the buttons to learn more.
Benign lesions consists of various conditions, which include the following.
Click on the buttons to learn more.
Oh, wow, that's a lot. Condo, Mata. Okay, what's going on? It's not going away. What am I doing wrong here? Ah, here it is. These are all Latin words, right?
Right.
Pre-malignant skin lesions are not malignant. However, if left untreated, may become malignant skin cancers and include conditions such as squamous cell carcinoma in situ, Hutchinson's melanotic freckle, and actinic keratosis.
Click on the buttons to learn more.
We already did that one. If I'm going too fast, let me know. Tell me to slow down. And you guys on YouTube too, because I know it looks like there's some kind of tape delay. I'm not sure. Now let's do malignant.
Malignant lesions of the skin are cancerous and can be broadly classified into three types, such as basal cell carcinoma, squamous cell carcinoma, and melanoma.
Click on the examples to learn more.
Squamous cell carcinoma of the skin of the right cheek, looking at the table of neoplasm. So it's basically telling you how to work the ICD-10 book. All right, I'm going to skip past this. Let's go to procedure.
Procedures performed on the integumentary system for destruction of benign and pre-malignant lesions are reported with codes 17000 to 17250. These procedures are classified into the following categories.
Click on the buttons to learn more.
Okay, this is where you need to take some good notes, write as much as you can.
Destruction of pre-malignant lesions are reported with code range 17000 to 17004. Key aspects to consider when coding for pre-malignant lesion destruction procedures include the following.
Click on the examples to learn more.
It's telling you as a heads up, coders, underline or highlight pre-malignant as a reminder in the code descriptors, each in a descriptor for code 17003. So it's giving you a hint to underline that word. So you may want to do that or highlight it in your CPT book right now as we're talking. And then it says destruction can be performed by using methods such as laser, curtailment, cryosurgery, chemosurgery, and electrosurgery. The size and the location of the lesion is not indicated in the descriptor. Use the modifier 22 to report substantially increased work for complicated destruction. And then I need to scroll down. The physician must demonstrate the increased services in the operative report to substantiate the modifier 22. Okay. Codes reported for different malignant destruction procedures include the following. Code 17000 is reported for destruction of one lesion, and additional code 17003 is reported for 2 through 14 lesions, and code 17004 is reported for 15 or more lesions. Any questions on this before I hit the next button?
Nope.
Okay, I'll wait for a second because it looks like there's a delay on YouTube. So I'll wait for a second for them to reply back to me. Is there any questions, YouTube, before I go to the next screen?
No.
Type yes or no, please, so I can go to the next screen. Okay, they heard me. All right, next. And then here's an example code. A patient with actinic keratosis of the left leg presents for destructions of 18 lesions. The area was anesthetized with local anesthesia and prepped. 18 lesions were destroyed with cauterization. Code 1704 for 15 or more lesions is reported for this procedure. Anybody have any issues with that example? So it's 18 lesions. 18 lesions were destroyed by cauterization. So code 1704 represent 15 or more lesions. So that will be the code of choice that you would select for that example. Any questions on that?
No.
You guys are following in your CPT book, I hope. All right. And then this is 17000 and 17003. A patient with active keratosis of the left arm presents. Can you click the left example really quick? This one? This one? Or my left? Angie? Hopefully that's the one you're talking about.
Actually, if we're looking at it, the left one is the 17000 and the 17003.
Okay. I don't know if there's a delay because I hate doing it like this, but it is what it is. We have to work with it tonight. So this one says a patient with active keratosis of the left arm presents for destructions of these lesions. The area was anesthetized with local anesthesia and prepped. The area was 13 lesions were destroyed with liquid nitrogen. Codes reported are 1700 for the first lesion, and add-on code 17003 is reported for each additional lesion, which totals to 12. Okay? Which totals to 12. So that's how you're going to report these codes. Any questions on this before we move on?
No.
Okay. Oh, okay. So the YouTube slides appear better on YouTube. Okay, I got you, Angie. Thanks for that. Tell me that. Okay, but there's a delay. All right. Integumentary system. Okay, so there's 10 medical terminology questions on the COC. So I was right. Okay, so I was right. So it's pretty much the same thing as a CPC then. So yeah, and you don't know which one they're going to ask you. That's the thing. You really don't. So it's like you have to study everything in order to be able to digest it and know exactly what they may or may not ask. All right. All right. So the next sets of codes we're going to look at is destruction of benign or pre-malignant. And so we're going to do 17000 to 17004 first. And it tells you destruction of pre-malignant lesions are reported with code range 17000 to 17004. Key aspects to consider when coding for pre-malignant lesion destruction procedures includes the following. Underline or highlight pre-malignant as a reminder in the code descriptors, each in the descriptor for code 17003. Okay, so underline or highlight the word pre-malignant right now in your CPT book, please. It says destruction can be performed by using the methods such as laser, cryosurgery, chemosurgery, and electrosurgery. The size and the location of the lesion is not indicated in the descriptor. Use modifier 5022 to report substantially increased work for complicated destruction. The physician must demonstrate the increased services in operative report to substantiate modifier 22. What does that? I feel like I already went over this.
Because you just did.
Then why didn't you stop me, Mary?
Go back.
Mary? Why didn't you stop me? Oh, yeah. See, it's been a long day. So we went over this one. We didn't go over this one? Is that what it is?
Yep. Go to that one.
Destruction of cutaneous vascular proliferative lesions are reported with code range 17106 to 17108. Key aspects to consider when coding for vascular lesion destruction procedures include the following.
Click on the examples to learn more.
Okay, the patient presents for destruction of senile angioma of the right lower arm because of constant bruising and bleeding when bumped. There are angiomas of approximately 2 square centimeter times 1 and 3 square centimeter times 3 and 5 square centimeter times 1 on the right hand and 2 angiomas on the left forearm, each 3 centimeters. The angiomas were ablated using a pulse dye laser. Report code 17107 because the total square centimeters involved is 22 square centimeter. Only one code is reported for the total square centimeter involved in destruction. Any questions there? Okay. Which one? This one?
Destruction of benign lesions are reported with code range 17110 to 17111. Key aspects to consider when coding for benign lesion destruction procedures include the following.
Click on the examples to learn more.
Patient presented for removal of 18 plantar warts from the left foot with local anesthesia and a CO2 laser destruction. We're going to report 1711111, and then that's reported for this procedure. That's what we're going to report there.
Chemical cauterization of granulation tissues, such as proud flesh, sinus, or fistula, are reported with code 17250. This code must not be reported with removal or excisional codes for the same lesion.
Click on the examples to learn more.
The patient presents for treatment of granulation tissue following burn to the right forearm. The granulation tissue is preventing the injury from healing. A small amount of silver nitrate is applied to the wound and a dressing is applied. Code 17250 is reported for this procedure. Any questions?
There's also 3 parenthetical notes like do not report with that 17250.
Okay, that's good to know.
Procedures performed on the integumentary system for destruction of malignant lesions using any method are reported with codes 17260 to 17286. Key aspects to consider when coding for malignant lesion destruction include the following.
Click on the examples to learn more.
It says codes are specific to the destruction of malignant lesions. Codes are based on both the anatomical site and the lesion diameter. And then it says lesions are measured by the widest diameter plus the narrowest margin times 2. It says the size of a lesion measuring 3 centimeter by 2 centimeter with margins of 2 millimeters, which is 0.2 centimeters, equals 3 centimeter plus 0.4 centimeter. That's 0.2 plus 2 equals 3.4. That's how you do the math on that. So I would take an example of this because when it comes to this section of the CPT book, you have to do the math. You have to do the math. So I will take a picture of this so you can see how they break it down. It says underline or highlight the sites for each grouping of codes for easy reference, such as the trunk, the arms, legs, scalp, neck, hands, feet, genitalia. This destruction can be performed using any method. Here's an example. The patient presents for treatment of basal cell carcinoma of the left forearm. The area was treated with local anesthesia and prep. 3 lesions of 1.0 centimeter, 2.0 centimeter, and 2.6 centimeter were destroyed with cautery and curtain. Because the lesions were all in the same area in different sizes, report codes 17261, 17262, and 17263. All right. Documentation dissection. It's going to be the next one.
This operative note describes a verruca vulgaris on the right third finger palmar and actinic keratosis on the right forehead.
Scroll through the documentation now. Click the button for more information.
Okay, we're going to do this as best as we can, okay? This is the scenario. Patient complaint of wart in the right third finger palmar, small, persistent for over a year, no symptoms, warts, treatment. He wants treatment. Patient complains of dry patch on forehead, no bleeding. There several weeks, no symptoms, no prior treatment. So 2 different locations that we're working on today. The third finger, the palmar, the forehead, dry patch. Let's see what they're going to do. The exam shows on the right third finger palmar a flesh-colored verrucous papule, 2 millimeters. Exam shows on the right forehead inflamed erythemus hyperkeratotic papule. Treatment: Valcor's right third finger palmar. Liquid nitrogen was applied. 1 lesion was treated today. Routine wound care. Acne, keratosis on the right forehead. So these are your diagnoses. Okay. You have the vertical vulgaris and the acne keratosis. The location, right finger, right forehead. Liquid nitrogen was applied. 1 lesion treated today. Routine wound care. Patient warned of pain, blistering, scarring, depigment changes, and lack of response. Patient advised to RTC if not resolved in the next few weeks. RTC means return to clinic. Patient verbalizes understanding of treatment plan and instructions. Patient understands to call with any questions or concern. Sunscreen emphasized with patient. Patient advised on regular skin exams and self-exams. Okay? It says the procedures included destruction of benign lesion and premalignant lesion, the acne keratosis. In the CPT index book, you will look for destruction, skin, and then benign. This is the order that you will look for indexed in your CPT book. Destruction, skin, and then benign. This reference to you to the code region 17110 to 17111. Then it says report code 17110 for the destruction of the report verrucous vulgaris for the wart. Next, look in the CPT index for destruction of the skin premalignant. This will reference you to these code sets 17000 through 17004 and 96567. Those will be in your index. While the acne keratosis of the forehead is reported with code 1700, modifier 59 is added, appended to confirm, indicate that this is a separate procedure and should not be bundled with code 17110. So you would add the modifier 59 in that case. Okay? So what code we're reporting? 1700 with modifier 59. Any questions? YouTube or those in the live studio with me? No questions?
No questions.
Okay. It's trying to load. I'm not sure what's going on with it. None but technical problems tonight. Yeah. Maybe it's trying to tell me something. This is weird. That's right. Nope. It's stuck. It's not moving forward. Okay. So maybe we'll stop here because I don't know what's going on with it. All right. Tomorrow night, let me ask you this. Can anybody sign in as early as 6:30 tomorrow night? Who can?
I can. Mary can.
Yeah, it's telling me it's quitting time, Angie. Yes. Mary, you can?
Yes.
Okay. Um, type in the chat, YouTube viewers, tell me if anybody in here can join me as early as 6:30 tomorrow. Say yes for 6:30 or no for 6:30 so I know that you understand because I know there's a delay. Sandria, Betty, Delona. Okay, more than likely it's going to be on YouTube, so you can pretty much pick up the YouTube and just, the same channel. I doubt this is going to be fixed by tomorrow. I highly doubt it. Okay, so 6:30 is. So we have a date, 6:30 tomorrow. Pray to God that my wife doesn't try to get me to do something tomorrow evening and ruin my plans. But I need to get done 6:30. We're gonna go from 6:30 to 7:30. I have to get done by 7:30. That's why I'm proposing that. Then, like I said, Saturday, hopefully I can. It's gonna probably, if nobody registers for the 3M class, then we will do an early morning session on Saturday, um, probably about 10 o'clock. And Jennifer says maybe. And Jennifer, you don't join me then. If you can join me on the weekend, that's good too. But I'm gonna keep this going. I want because of the fact that we're so behind. And it's don't blame me, blame my wife. And then these technology situations popped up now that makes it ridiculous that I have to do it this way. But it is what it is. Let's try to make the best of it and keep this thing going. Okay. But if that's it for tonight, guys. I thank you so much for joining, and just keep the link for tomorrow night so it's going to be right here tomorrow night. I'm pretty sure of it. Hopefully by Thursday, so we can get this rectified and sorted out. Somebody send me something in private chat. Let me make sure. Okay, Lejaja said no, she can't join. Well, Lejaja, I mean, the best we can do is, we'll catch you up.
I'll try later. Yeah.
Yeah, we'll catch you up. All right. It's telling me it's quitting time because the thing is still going around in circles. It's not moving. I mean, was there something else that I was supposed to hit? I'm not seeing that. I can't believe that. But anyways, we'll figure it out. All right. So talk to you guys tomorrow. Go eat some dinner or go to your bed or whatever the case may be. I'll see you guys tomorrow. Have a good night.
Good night.
Thank you.
All right.